聊天了，因为他。
In 3 minutes. Ariel, we'll start. Okay.
Yes.
So, good morning in Israel and nice afternoon here in Beijing and all around China. I'm Esti Elon Kobo. I'm the head of the economic mission at the Israeli embassy in Beijing. Together with me are also the economic consuls around China, Niv Hanan from Shanghai, Ev Ermishin from Chengdu, and Shirley Kaufman from Guangzhou. Of course, our partners, IsCham, that will present their activities in a few minutes, and Dr. Galia Barkai, head of general manager of Sheba Beyond. First few technical instructions to make this experience more convenient and efficient. Here is the list of our trade directors. Most of you are well familiar with them. Simin Yan here in Beijing, Kathy Thong from Shanghai, from Chengdu, sorry, Tina from Shanghai, and Xiao Zhang from Guangzhou. You are more than welcome to connect them. Some technical instructions. First of all, change your name. If you can, to change to English name in order to make it more easier for us. Company name and attendee name. Interpretation. You may click the interpretation button below to hear English Chinese version. We have a simultaneous translation during the whole event, and you just need to make sure that you are on the right channel. Question. If you have question, please write your question in the Q&A box or click raise hand. Simin Yan will follow the question and we can refer them directly or after the event. The B2B meeting, very essential part of this event. To provide you with a better experience, we can spread the B2B meetings in several days, and we'll only have a small portion of them today. Our trade directors, in coordination with IsCham team, will be in touch with you to continue scheduling more and more B2Bs. If your B2B meetings will happen today, please click the right links at the right time according to what we sent you before. Each meeting will last 20 minutes. You'll get a notice at the last 16 seconds. This is the agenda. After me, Ariel will talk, Ariel Biskin, General Manager of IsCham China, and then the keynote speaker, Ms. Dr. Galia Barkai, General Director of Sheba Beyond. This is the order of the pitches of the Israeli companies, and then, of course, the B2B part. Thank you. A few more words about China-Israel telemedicine and Sheba Beyond virtual event here today. First of all, this is our team, the Israeli Ministry of Economy in China. I think we have the biggest team. The biggest team of our ministry is here in China. Why China is very important to the Israeli export. Here in Beijing, we are two attachés. We have Yair that is responsible for all the sectors. I'm leading the health sector and also leading the regulation team. Niv Hanan, as I mentioned at the beginning, in Shanghai, Heather Ermishin in Chengdu, Shirley Kaufman in Guangzhou, and Yoav in Hong Kong. Let's go deep to the subject. Healthcare in China. Healthcare was included in the 14th five-year plan. As you can see, these are the four main items that were defined. The healthcare was included in this plan, and with specific focus on well-being and the third age. This is to show you a bit about the changes in the market of healthcare in China in the last 10 years, from 1.9 trillion in 2010 to 8.7 trillion in the last year. It's very big numbers. Here you can see Chinese patients expect to use more digital services within the next 5 years. The biggest increase was in the telemedicine area. And we assume that it will continue increasing, especially in this area. Size of the telemedicine market in China in millions RMB. 2015 we started with 41 million RMB. 2019 more than almost 150 million RMB. The penetration rate of China telemedicine industry. It's interesting to see the increase, and the main increase was, of course, due to COVID-19. I don't think I need to elaborate more about why. We can see that in the number of Chinese hospitals with their own telemedicine platforms, the biggest increase was during February 2020. And we assume that it will continue. More than 6,500 companies, Chinese companies, are active in the area of digital health, mainly in HIT, telemedicine, smart device, and health. It's, of course, big numbers because it's a very big country as well. Israeli telemedicine. COVID-19 brought a new normal to medical treatment, but it's not something that started during the COVID-19. It's something that started much earlier. 10 years of change in 1 week, telemedicine on fast track. This is a quote, I'm quoting an article that was in New York Times in April, almost a year ago, exactly a year ago, on what is going on the Israeli market in this area. Digital medicine, remote treatment, big data gathering, AI, robotics, and generic information. This is the future. More than 500 digital medicine companies operate in Israel. Around 500 medical device companies that have digital application for home use. This is to give you a look on a high-level ecosystem map. And you can see the digital health is increasing more and more. This is a summary, not all the transaction, but the main transaction made in the 2018-2019 in the area of healthcare and digital health. Because we want to make sure that we are due to time, this is a list of our attachés here in China. This is the emails. You are more than welcome. This is our main job here is to promote export of Israeli product into China and to attract Chinese investment into Israel, quite similar to what IsCham are doing. So you are more than welcome to approach us, and we'll be happy to assist. And now I will give the floor to Ariel from IsCham.
Hello, everyone. Good afternoon as well from China. I'm actually in Jinan right now. I hope Dell is the translation working well for our Chinese. Okay. Okay. First, very big thank you to Miss Esti Alon-Kovo, the commercial attaché at the Israeli embassy in Beijing. We work pretty close together also to promote and help both sides to achieve cooperation. She's doing also a very important job in terms of regulation, which I think is important to emphasize. And this is not everyone can see, but she's doing an amazing job there, and to ease and all the challenges in regulation, which is also obviously a very big part of this industry. Of course, big thank you to Dr. Galia Barkai, who will present their extraordinary and amazing project, Sheba Beyond, their virtual hospital. Of course, one of the main hospitals in Israel, and considered the number 9th in the world, according to what we heard recently. And of course, all the other consulates that they also joined today and helped us to promote this event and connect with Chinese companies to introduce them this event. And also Esti and her team, Seeming, who worked on this event, very, very important. And of course, big thank you to my team, Dale, Jingyi, Iris, our partner in Israel, Tzlil, that managing via Meshi, who all worked hard. Everyone today thinks that doing online events is easy, but actually there's a lot of work behind the scenes. So thank you very much, everyone. I will not talk too much about the obvious, which is the huge potential and in the telemedicine market, which I think is also Esti mentioned, which is quite clear to everyone. I will discuss shortly about the IsCham plans and work. Today we trying to also, I think it's could say our first priority healthcare because of the big need in China, and also the big and also the innovation that Israeli has to offer in this field. So that's why we choose, and there are not enough, I think, even now organizations that help to create cooperation in this field, because this is such a big industry, such a complicated industry, and we need more and more partners in order to achieve better and stronger ecosystem to support the Israeli companies here in China. For this reason, we as a chamber also building a smart network. We're trying to find different local professional organizations in different fields, so in different healthcare segment, from all kinds of places, governments, and provinces in China. And this is all in one cause in order to help better Israeli companies, because there's always someone who knows better their clients, their target audience. For example, we realized that a very big and important market in healthcare now is the elderly market. And we need professional organization, Chinese organization that understand this market better than us. So we also welcome all Chinese organizations, healthcare organization in different fields, in different segments of healthcare, to join hands with us in order that we can, of course, help better Israeli and Chinese companies to achieve some success. Of course, it's needless to say that B2B and this presentation is important. However, it's only the first step, and there's a quite hard and challenging way in the future in order to actually reach real cooperation between Israeli and Chinese companies or governments. And I do believe that we need to think always how we upgrade our ecosystem and how we support better the Israeli companies. And of course, obviously, I know some of the companies today that they are doing the right thing, which is localize their operation in China, which is having local team, working with local partners is critical, and putting time and money in order to develop in this market is of course unavoidable and something that must do actually to achieve success. And of course, we encourage everyone to take this to consideration when you approach the Chinese market. And last but not least, of course, I want to say a big thank you to our Chinese audience and Israeli companies, and wish them great success, because we're just the background and you are the important ones, because we're doing all this in order that you can have hopefully some cooperation in the future. So I wish you all good luck and have a successful event today. And I will, my next speaker. Sorry, yes?
Yeah, give the floor to Dr. Barkai.
Yes.
Okay, so Good morning, everyone. First of all, let me say good afternoon for you. Thank you for inviting me to this important meeting. And I'm very honored to be here and share a little bit of what we did in the field of telemedicine during COVID-19 in Sheba, and talk to you a little bit about the concept of Sheba Beyond. So as I don't know if you know, but Sheba is the biggest hospital in Israel. And as I think Ariel said, it's been nominated for the third time in a row as being one of the 10th best hospitals in the world by the Newsweek magazine. And as Esti said before, we've been already doing telemedicine before. Telemedicine is not new. We had project of telemedicine, but it didn't reach the mainstream of medicine until COVID-19. And our story actually begins on February 18. We still didn't have COVID-19 in Israel, but the government decided to bring back Israeli citizens that were on the cruise ship Princess Diamond and were exposed to COVID-19. And there was a big, issue about bringing COVID-19 to Israel, and we were given, Sheba was given the mission of hospitalizing these patients in isolation. And we quickly understood that we wanted to make a new concept of isolating these persons and treating them from afar, with minimizing the physical contact between the crew and the patients. And we wanted to use telemedicine tools for these hospitalized patients. And it was the first time that we did it, because we did use telemedicine tools for people that were far from us in distance. So what we did, we only had 3 days, and we called all our partners, most of them are Israeli companies, around the table, and said, let's find out how can we do really quickly, find in which way we can give the best tools for treating these patients. And we came up with a solution. What we did was actually we called it the teletent. We hospitalized these patients what we made a ward outside of our campus. We created a ward, we built a ward, and all the medical staff was placed in a tent, which is a field hospital tent that we use for missions outside of the country. And they had all the monitors they needed. We left some technologies in the patient's room, and we did most of the things that we needed to do from outside, from this tent. We called it the teletent, obviously. So what we knew we wanted to do was 3 major things. The first was communication. This was crucial, because we knew if we cannot communicate with these patients, we're done. We cannot run, this whole project will go down. And for this, we used an Israeli company, which is named Uniper, that makes your TV screen. We had TV screens in these rooms, a companion from which you can do easily performed video conversations. And that's how we did all our rounds and group meetings and family meetings. We also used for monitoring early sense. We did ask the patients to check their blood pressures and vital signs 3 times a day, but we also put this early sense, which is a continuous monitoring sensor that you put under the mattress, touchless. You don't have to let the patients do anything about it. And it measures your respiratory rate, heart rate, and motion, but it also has an AI algorithm that can predict deterioration in the patient's state. And we use for physical examination, the Israeli physical examination kit, which I believe you'll hear about in the future, which is TytoCare. This allowed us later on, when we open new wards, to use TytoCare even from inside, which means that if you want to check a patient and you're inside and you use all your PPE, you cannot put a stethoscope in your ears and at the same time touch the patient. And this tool allowed us to make a whole physical examination while not touching the patient. So here you can see some nice thing. They check if the nasogastric tube is inside by putting the Tyto on the stomach of the patient, and the doctor outside is actually receiving the voice input and can see if it's in place. Another tools tool that we used when we began to have more and more COVID-19 patients inside the hospital is the InTouch Health telepresence robots that we used in order to decrease the number of caregivers that are needed inside the room. Of course, when people are in ICU, especially when they're on ECMO, they do need a lot of staff around them, but we could do a lot of the work from outside using these telepresence robots. As you see here, we opened a new control room, which was much bigger with many more screens, and we were able to do a lot of the work from outside of the room without needing to touch the persons. Let me fast forward to 1 year forward. We did have to open a new ward for women in pregnancy and during labor because we have now the British variant that causes severe infection in young women. And we opened a new ward just similar to that, using technologies that will be able to help us decreasing the need of the physician to go inside of the room, such as Pulse and More, which is a portable ultrasound that the patient puts on herself using her cell phone, and Heramed, which you will hear about in a few minutes. And in this way, we were able also to check these technologies and also allow us to do the first steps before sending patients home using these technologies and decreasing the need of the physicians and staff to go inside the rooms of the patients. So the first thing that we talked about now is how we took care of the isolated corona inpatients, but soon we understood that most of our Sheba's patients are not hospitalized, and we do need to continue to take care of them. We wanted to have continuity of care for the ambulatory patients, for example, our cancer patients that cannot come to the hospital during the first lockdown. So what we did is, as we were using already telemedicine technologies, we had a telemedicine platform that we were using, which is an Israeli platform named Datos. We transferred very quickly all our outpatient clinics to video clinics using a very easy interface in which you can write down the number of the phone number of the patient. The patient receives a text message, clicks on a link, and is quickly referred to a secure video visit. And in this way, we could continue to take care of all our outpatients, and we still do that. Of course, after the first lockdown, the numbers decreased, but we continue steadily to see hundreds of video visits every day in Sheba using this platform for our outpatient. We finished the year 2020 with more than 60,000 video visits. Just to compare, the year before we had maybe 100 or 200 video visits. This quick deployment of telemedicine technologies allowed us to learn very quickly how to improve ourselves. We did some improvement process. First of all, we did technological improvement. Since we work very closely with Datos, we continue to give them feedback all the time about how to make their technology better and most suitable for us. We completed the administrative process, which is sometimes very cumbersome, and you have to do a lot of work to integrate it into your administrative process. We didn't have the time to do that at first, but we're continuing on working on that. We created a support center for our physicians and nurses and all our medical staff. We provide patient guidance, and also we created a special course of clinician training with our medical simulation center, which is mainly to increase the way of how they do communication from distance, to increase their modalities of communications. So what we learned from
COVID-19, we have 2 minutes.
Okay, we learned that telemedicine is not a constraint, and we do know that it can empower patient and caregiver to allow for better quality, efficacy, and accessibility of healthcare. And we understood that we have the tools that we can use now for solutions that are highly scalable. And we decided to change our perception of the new hospital. Now our hospital would not treat only inpatients or patients who come to our hospital, but we decided to create a new hospital, new project in Sheba, which we call Sheba Beyond. And our vision is really to redesign the way we provide healthcare to make it more accessible, innovative, and tailored, using our clinician, our specialist clinician, and the technologies to give a wide array of services from distance. So we created Sheba Beyond, which is a real hospital. We have a website if you want. We have services of home hospitalizations. We have rehabilitation services. We take a lot of care of chronic patients, and we also do acute care. I believe I don't have a lot of time to talk about some of our projects, but one of them is the first in Israel and maybe the first in the world program of a psychiatric hospital at home. We have a pediatric obesity program for chronic children that uses not only a telemedicine platform and wearables, but it also uses a gaming application and physical rewards to increase motivation. And we have a platform that was developed in Sheba for rehabilitation that does all the kinds of rehabilitation using our clinicians and the special technologies, the software to allow gaming as well. So the future of telemedicine is already here as we employ already AI, VR, and AR, and also try to use robotics. But I believe that this will not cause our clinicians to be far. It will not replace our clinicians, but it will bring our specialist clinicians closer to our patients. And we believe that we can create global and social impact with telemedicine, which really can transgress the geographic, time, social, and cultural, and even political barriers between us. And it has the potential to allow healthcare for anyone, anytime, and everywhere. Thank you.
Thank you very much. I think that Sheba is a very good example to see that it's not only the private sector that can be defined as innovative, also the big hospitals like Sheba. Thank you very much. I will give the floor. We'll move to the company's part. Miki Raviv from Vitalital, please take the floor. You have 6 minutes, Miki.
Oh, that's great. I got 20% higher. Okay, let's discuss. So thank you, Esti. Hi, everybody. I'm Miki Raviv, founder and CEO of Vitalital, and I would like to share with you what we are doing. Actually, we're addressing one of the key global markets, which is the aging market. You know, it's about 20%. In China, we're talking about 270 million nowadays, and by 250, it will double. So I would like to start with sharing with you a video and then explain our key technology and market penetration.
维特尔利用纳米级生物传感器和人工智能算法，持续对用户心率、呼吸率、体温、血氧等体征进行监护。维特尔健康盒可实现7×24小时全天候无间断监护，尤其是在老人准备起床时，系统通过体姿分析发出警报。另一个特色功能是预防压疮，如果低于设定值，系统便会提醒护理人员协助翻身到具体方向。维特尔智能健康云监护系统同样适用于家庭监护，家属可在手机等终端随时关注长者的健康状态。当老人夜间离床超过设置时长，系统便会连线紧急健康关怀客服中心，降低意外事故的发生风险。当老人进行户外活动时，即可实现对老人的实时健康监测，降低突发心脏病等的意外风险。维特尔只为优质防护。
Okay, so we have developed a unique health platform, which is a combination of 3 technological parts. One is contactless biosensors that convert any bed, wheelchair, sofa to smart by just touching below. These sensors require only Wi-Fi in order to connect to an AI machine, deep learning, that build a patient's health profile 24/7, 365. and softwares that predict patients' health deterioration in order to alert care on duty like nurses, caregivers, family members, and managers. The key value of our solution is proactive and preventive. So dealing with the elderly people, we are talking about falls problems, pressure ulcers problems, and using our platform, we prevent those things. Customers that are using the solution enjoy a reduction of about more than 70% out of the falls and more than 80% of pressure ulcers. We prevent sepsis, which is one of the toppest hospital killers, by analyzing the patient's trends and alert prior deterioration and heart incidents, irregular breathings like COPD, asthma, epilepsy, seizures, and hyperthermia and ischemia. We open a local office in Guangzhou, and like Ariel mentioned here before, it's a Kittings. We have about 15 local employees in marketing, sales, business development, and we expand our presence in the key provinces in China, including Guangzhou, Shanghai, Beijing, Sichuan, and Delta. Our partners are leaders in the areas of health and real estate, areas like China Resource Land, Hushio, RNF, and through these channels, we are accessing a wide market. Besides China, after we went market about 2 years ago, we gained a presence in 4 continents, including Europe, South North America, Japan, Australia, and of course China. And now, because we signed a peace agreement with our partners in Africa, so we expect soon to have also present in that area. You can see in this presentation, in this slide, the market penetration in Israel, in China, in Japan. We collaborated with one of the local largest health providers called Unimat, which managed more than 700 facilities across Japan, UK, America. So compared to startup company, it's quite a good footprint.
Mickey, okay, good. Less than 1 minute.
Just to share with you a dashboard so you can understand the solution. You can see here in real time a hospital that is using the solution and enjoy the alert preventive things that we provide. Of course, we'll be very happy to discuss with you B2B. Thank you very much.
Thank you, Mickey. Vitalitar. We'll give the floor to Title Care of Urban Zvi.
Just 1 second. Can you see my screen?
Yes.
Let's start in the beginning. Sorry. Okay, so 大家好，我是 Offer， 我是Title Care 的销售总监，在中国。我们是以色列延长医疗的公司，在以色列成立了。我们是世界上最完整的延长医疗解决方案。我们这个系统有3个部分的，是延长医疗的完整解决方案和平台。第一个部分是家用使用的部分，用Title Care iOS 和 Android 手机的 APP 加连接的器械。第二个部分是医生的 APP， 这个是互联网电脑的 APP。第3个部分是我们的云端的系统，它是Title体检、Title挂号、连接和分析工作。这个系统都可以整合，用我们的 API 跟各种各样的这个医疗机构的 EHR 和其他的系统。 我们是全球第一完整的家用体检和诊断解决方案，是简单是用几个部分的，有器械的，有配件的，还有这个手机的 APP， 可以体检这个喉、心脏、心率、温度、肺脏、耳朵、胃肠和皮肤的。这个是简单的家用诊断工具的，任何人都可以用。用专利的人工智能技术帮忙这个病人做家里的这个体检的。这个器械是用模块化的设计，所以可以加进去多一点的这个功能。然后它是靠大数据技术的分析的。它是也是用这个云端的远程医疗平台。有两个这个使用模式的，第一个是离线模式，第二个是这个在线模式的。离线模式的是在家里病例自己用我们的这个人工智能的这个能力的，他自己做体检发到他的医生，可以看这个例子，比如说这个耳朵的、嗓子的、心和肺的声音等等。然后有在线的模式，在线的模式一部分有病例的，在另外一个地方有医生的，他们俩都用这个我们的 APP 和系统，还用我们的这个设备，他们是做一个视频会议，然后视频会议也可以加这个工具的这个器械的这个体检，医生可以做远程的这个体检，因为是多功能的这个设备。所以可以体检比较多的这个疾病，包括呼吸道疾病、心脏病疾病、老年人、儿科、皮肤科、慢性病等等。我们有两个产品在我们产品线，第一个产品是 Untitled Home， 在家里用、消费者用的这个解决方案，目标的客户是有孩子的家庭，还有老年人的病例和慢性病，在家里慢性病的人。Untitled Pro 是被护士和其他的人或者安装的，他的目标的这个客户是女性护士、药店和小门诊、小学的这个门诊等等。你们可以看一下，这个是一个例子，是怎么用我们的这个设备。在家里，妈妈可以体检孩子，然后发给医生。比如儿子有耳朵炎，但是不要带着去医院的。比如天气不好或者孩子不舒服的，你可以在家里体检发到医生，然后医生给你他的这个建议。这个一个脖子的这个嗓子的这个体检也是一样的，也是可以用我们的这个听诊器听这个心和肺，还用其他的这个功能。我们现在在全球已经安装了和使用几十万的这个设备，在各种各样的地方。特别在美国，但是也有南美的欧洲，我们也是已经进入这个市场。我们是跟瑞卡瑞士第二个最大的保险公司合作，在以色列跟这个克莱利是以色列最大的HMO 合作，也是在亚太地区已经开始做这个市场进入和合作。这个是我们态度支持看新冠肺炎的时代。我们是第一个是可以做远程监视病人的，病例在家里隔离的，可以做一个监护的，然后女性护士也可以用的，所以它是减轻医疗系统的压力，然后也是可以用在医院的做这个病例分类和选择的，协助这个优化医疗服务。这是我们全球的一部分的这个合作伙伴和客户，包括保险公司、医院等等。这个是我们的工厂的。然后大家如果有其他的问题，我们可以随便联系，也可以在 B2B 给你反馈的。谢谢大家。Thank you very much.
Thank you. I will give the floor to Neurotech Oad Lavi.
Hi, just a second. Okay, good afternoon, everyone. My name is Ohad Lavi. I'm the CEO of Neurotech Solutions. I'm very happy to be here today. I always like to start with this slide because it shows very clearly why we wake up in the morning and get to work every day. Our mission is to eliminate undiagnosed ADHD and to improve the quality of life and increase the potential of life for every child worldwide. This is why we wake up in the morning. Because you see, a child with ADHD, it's very easy to get to a negative place in life. In fact, around 60% of prisoners have ADHD, and there is a fourfold chance of death from accidents and substance abuse for people with ADHD. But on the flip side, there are some very famous people in the world who's made it very well for themselves despite having ADHD, or maybe even because of that. People like Michael Phelps, the swimmer, JFK, even Albert Einstein is suspected to have had ADHD. So the real question becomes, how do we help children move from the negative aspect of ADHD to the positive side of ADHD? And we believe the answer to that is by getting to them early on at their tipping point with early diagnosis and early intervention. And this is exactly what we are doing. So back in 2008, we started developing an attention profiling engine that looks like this. It has two versions of the test for children 6 to 12 and for adults 13 to 17. There is a target element that the user needs to react to by pressing the space bar once as fast as possible. They need to ignore non-target elements. And there's a lot of distractors that are also visual and auditory that are distracting them from this relatively simple task. This whole system is online cloud-based, and you'll see the implication of that in a second. But first, I want to show you a short demo of the adult version of the test. So again, here, the task is to react to the target element, which is the card of 3 hearts. And it's not easy, as you can see. So we've applied this test in 3 verticals: in the clinical for diagnosis of ADHD, screening for attention, and treatment. In the aspect of treatment, and we've worked with actually with Sheba for many years as well there, the MOXO is one of the leading tools today for the diagnosis of ADHD. It's a decision support tool, the only objective tool in the basket of the physician. And as I mentioned, it's online cloud-based, so that means that it could also be done from home. And around 30 to 40% of diagnosis with MOXO in Israel and around the world is now done with the home testing version that we launched because of the corona. It's the only one that is online, it's the only one that is gamified, and it's the only one that has distractors, so that makes it very, very unique in this space. The other vertical is the screening. So now we go into schools and we allow a mapping of the attentional capabilities, and we highlight the strengths and weaknesses of children to help them perform better. And we've done that in many schools already in Israel and around the world. And it's a very good way also to assess children who have difficulties that usually fall between the cracks and are neglected.
Add 2 minutes, please.
Yeah. The third aspect is the treatment, where we work with and collaborate with other Israeli companies, where we use the test as the initial trigger to create a personalized treatment plan with the collaboration of other Israeli companies. You see here, Mindlift, Bobo, and BlazePod, that we kind of borrowed into the world of attention, and we use that as a platform. The idea is to create an ecosystem around the child using all the technologies managed through a mobile application that we are now building that will also create a marketplace around the child and will offer treatment, psychological counseling, parental guidance, etc. This is our team in Israel. We have a strong team also in China. We opened the offices 2 years ago, led by the VP Sales, Lucas, that is also available to meet with you. And we have a very strong advisory board for the meeting. One of the most important one is Professor Sam Goldstein, who is the chief editor of the Journal for Attentional Disorders and a big asset for the company. That's it. If you have any questions, I'm happy to hear more, and we're obviously available for meetings with you later on today. Thank you very much.
Thank you, Ad. It was very interesting. Now, Temi Robots, Gad Goren. It's your
Hello.
turn.
Nice to meet you all. My name is Gal. Just let me share the screen properly. I can't do two things together. So I'm the co-founder and the CEO of Temi. I'm based in Shenzhen in the last 4 years. We are running all our global operation from here. We have more than 60 local employees, and China is taking a big part in our business game. When we thought about Temi, there were a few things that guided us right from the beginning. The first was a design. Temi needs to be sleek, neat, clear. It needs to be the iPhone of robotics. The second thing is that it needs to be very intuitive to operate. So you don't need to code, you don't need to be a remote control expert, you just need to talk to it or to do some gestures to it. And the third thing was the cost. And we are compensating with very, very sophisticated AI algorithms over low cost hardware. So Temi is fully autonomous robot. It can arrive from any point A to any point B in the indoor environment. It has a video conference services, and it has smart assistant services. So in China, for example, we have strategic cooperation with Tencent. So Temi is fully capable to interact in Mandarin. But not only that, you can get all the services that the common user already gets from Tencent in his day-to-day use, like Tencent Video, QQ Music, etc., etc. But the most important thing of Temi, the most important feature is that Temi is an open platform. It means that any developer and any business can design its own applications for Temi. And if we are talking about healthcare, it means that any hospital, elderly care facility, medical care service can design its own applications and put it on top of Temi. We are operating from China all over the world in more than 16 countries, in Japan, Australia, Thailand, Singapore, Malaysia, and Indonesia. Of course, that also in Israel. And recently, we have new cooperation in the UAE. We have few distributors in the USA, Canada, and Brazil. And 6 weeks ago, we got the CE mark. So we can distribute Temi in Europe. So I think that the COVID-19, this period, put a lot of focus and understanding how autonomous system can help us in our day-to-day hospital life. Temi's main mission is to reduce the friction between the medical staff and the patients that are in the quarantine department. So we can see in many hospitals around the world, and I will share the use cases very soon, how Temi, as a fully autonomous system that has remote capabilities and video assistant, to be able to provide contactless hospital digital services to its patients. So we can see in elderly care, we can see Temi in the reception, or we can see Temi give medical assistance by combining blood pressure devices, oxygen measurement devices, temperature devices on top of Temi and sending it to the corona quarantine department. We can see elderly care using Temi with telepresence capabilities and using it for entertainment, consume news, music, books, and everything else. Some use cases you can see here, we are spread all over the world. And we can see Temi in elderly care facilities in Hong Kong. We can see it in hospitals in South Korea, in Hong Kong, in Israel as well. We can see examples of how to measure remote temperature and provide the feedback to the control room in not only in hospitals but also in airports, and the idea is how to bring the remote assistant directly into the medical quarantine department. So a specific use case that I want to share with you is in Taiwan. Taiwan is using TEMI to integrate add-ons of not only medical device, but also disinfectant materials like UV lights and sprays. In addition to that, they connect on top of TEMI blood pressure devices, temperature devices, and oxygen measurement devices. And the medical staff is working together with TEMI in order to provide remote service. So sometimes if it is allowed, TEMI can follow the doctor into the patient room. And sometimes if it's not allowed, TEMI is going autonomously between the rooms, asking the patient in his language to do specific measurement. The measurement is transmitted directly to the cloud. And by facial recognition, in the next time, the same patient will be connected to his own specific and secured database. TEMI is now entering very, very fast into the hospital market and elderly care facility market in China. And we are looking forward to cooperate with you in this industry. Thank you very much.
Thank you very much, Gal. It was very interesting. We'll give the floor to Sivan Sadan from HeraMed, our last speaker of this part. Okay, Sivan.
Thank you very much, Esti. Thank you for inviting me to present. My name is Sivan Sadan, and I'm the CFO of HeraMed. I would like to start with a short video. Just a second. So as you can see in the video, HeraMed is leading transformation in maternal care. We developed cutting-edge technologies, and what we're aiming to do is transform the way that home pregnancy is done. Our number one goal is to improve the health of the mother and the baby. In terms of the market, a lot has been said in this conference, so I won't elaborate a lot, but it's a huge market, over 200 million pregnancies annually. And what's unique about our end users is that they're very young. So mobile apps and connected devices are part of their natural lives. Our offerings are three main offerings. The first one, the HeraBeat that you saw in the movie, it's a medical grade home fetal heart rate monitor. The second line of product is the HeraCare. It's a pregnancy technology platform that provides a remote monitoring solution for the whole pregnancy journey. And the third product is called Orion. It's a software, AI software that we're currently developing with the Mayo Clinic. We're proud to say that we're not only partners with the Mayo Clinic, but also they're a shareholder in our company. The HeraBeat has an FDA, has a CE, has 13 pending patents. And what's most exciting, in my opinion, is that we have over 150,000 fetal heart rate measurements and growing very fast. One very unique feature that we have is that we're the only handheld device that detects not only the fetal heart rate, but also the mother heart rate and makes sure that there's no confusion between the two. We conducted independent clinical trials with astonishing results. 100% detection rate, accuracy was similar to hospital medical grade devices like the Philips or the GE. And we also got very good grades from both doctors and expecting mothers for the usability. We're also doing another trial with the Mayo Clinic, but most important for us is, of course, Israel, and especially for this conference. I wanted to show you the real-time pregnancy monitoring use case that we're doing with Sheba. The lower picture is basically myself 19 years ago when I had my daughter, and basically these technologies haven't changed since the 60s. And the upper picture that you see right here is the Sheba use case. So this is how Sheba would examine a pregnant COVID-19 patient. We're very excited to work with Dr. Avi Tzur and all of the visionaries that Sheba and Sheba Beyond, and we're very excited to be part of this Sheba Beyond idea and vision. And we're looking forward to provide premium maternal and fetal services with Sheba together. With regards to the vision, we're now offering hospitals and telehealth service provider not only fetal heart rate measurements, but a complete journey. A hospital or a telehealth service provider can add blood pressure management, weight management, glucose monitoring, activity tracking. We also have pregnancy education materials from the Mayo Clinic, and all of this information and inputs would be very easily viewed by the doctor in the doctor dashboard through a local
One minute, please. Sivan, one minute, please.
Okay, thank you. You can see here the mother experience through the HeraCare app. She could get reminders of what she needs to do. She could see the measurement history as well as the care plan and the pregnancy education materials. This can be customizable. So for China, we can use a different care plan versus what we do in the US. Last but not least, we have a great team. And I really would like to invite you to join us and step into the future of pregnancy care. We're really excited about what Sheba is doing, and we're looking forward to working in the Chinese market. At the moment, we work in Israel, in Australia, in the US, in Europe, and we're now looking into initial steps of penetrating the Chinese market. Thank you very much.
Thank you very much, Sivan. Thank you all the Israeli companies. It's always a pleasure for me to hear Israeli companies, the innovation, the passion, the motivation. We are handling this for years, and it's always amazed me, and I'm happy for that. Hope all of you had an interesting webinar, and I wish you'll have fruitful B2B meetings, and hope to hear about success stories in the near future. So now you can move to your B2B meeting rooms. You have the meeting rooms directors that waiting for you there, the managers, okay? So all the best and good luck.
Thank you.
Okay, bye-bye.
Thank you very much.